Are there special end of life considerations for someone experiencing homelessness?
Um, yeah, I mean, so I've done some work in this area, and there's a lot of people who have written about this. I think that certainly, um, the whole the end of life considerations and palliative care is challenging in the best of circumstances and is like 10 times more so when the person lacks housing. The um, I think that the special considerations, first of all, are that um, often uh, so often people who are homeless have either connections to family that are their street family or their family in the shelter or service workers who know them really well, and often they have those connections. And to some individuals, dying at home means being able to die at the shelter, which is kind of a difficult kind of request to honor, but it's important to realize that. So I think that's one thing. I think that the second thing is that obviously in some cases people are not in close contact with their family, and end of life the end of life period provides an opportunity for people or for them, or it's a time when they often desire to re-establish those connections, and we need to, I think, make sure that that's possible. I think that working as someone working in the hospital, unfortunately, what we often are facing with is someone who arrives in the emergency department actively dying, and we have no way of contacting the family, and sometimes even after the person passes away, we're struggling to find a family member. So I think that having those discussions with people uh, when before they're actually known to be at the end of life is really important. And I think that there is the surprise question. Would you be surprised if this person died in the next year? And if you say yes, if you say no, I wouldn't be surprised. That's someone that you should be having an end of life conversation with. I mean, I think that we should probably be, based on those criteria, we should probably be having those conversations with, the majority of people experiencing homelessness, right? Because either because of their physical health or their risk of overdose, there's a very high risk of death among the in the homeless population. So I think having those conversations and trying to, if not have discussions around advanced care directives, but at least around, next of kin and family is important.